Hey there. Look, getting a diagnosis of ulcerative colitis can be, well, it can be a lot. Suddenly, you're dealing with new words, new medicines, and just a ton of uncertainty. So, our goal here is to cut through some of that noise and walk you through what you really need to know so you can feel a lot more in control of your journey. For a lot of people, medications do a great job of managing their UC. But what if you're one of the people for whom that's just not cutting it anymore? What happens when the meds stop being enough to give you your quality of life back? That's the big question we're going to tackle today. So let's just jump right in. All right, first things first, let's get on the same page about what ulcerative colitis, or UC for short, actually is. Because really, truly understanding what's going on inside your body is the absolute first step to getting a handle on it. Okay, so at its very core, UC is a kind of inflammatory bowel disease. The easiest way to think about it is like having a really bad, really persistent sunburn, but it's on the inside lining of your large intestine. And that constant angry inflammation is what's behind all the tough symptoms, like the pain, the diarrhea, and the bleeding. And what's really key here is where this is all happening. The inflammation is usually just in that very top innermost layer of the colon, which is called the mucosa. It's the damage to this super delicate lining that causes the ulcers that give the condition its name. So let's go back to our big question. If the medicines aren't cutting it, what's the next step? For a lot of folks, the journey with UC is going to include a talk about surgery. And it is so important to see this not as a failure or some kind of last resort, but as a really powerful, proactive choice you can make to take back your health. And the reality is, surgery is a pretty common part of the UC story. The data shows that for about 3 out of every 10 people with ulcerative colitis, surgery is going to be part of how they manage the disease in their lifetime. So if you're even thinking about this, trust me, you are far from alone. And listen to this. This is what really drives the point home. In one study, when they asked UC patients who'd had surgery how they felt about it, more than half of them, more than half, said they wish they'd done it sooner. That just completely reframes the conversation, doesn't it? It shows that surgery can be a real turning point for getting your life back. So why do people choose to have elective surgery? Well, sometimes it's simply because the medications have stopped working to control the inflammation. Other times, it might be that the side effects from being on this meds for a long time are just becoming too much to handle. For kids, UC can actually interfere with their growth, and a big reason is also to prevent or treat cancer. But in every single one of these cases, the goal is exactly the same: improve your health and your day-to-day life. Let's talk a little more about that cancer risk, because it's a big deal. That chronic inflammation we mentioned, over time, it can actually increase the chances of developing colorectal cancer. You can see here, after 10 years with UC, the risk is about 2%. But after 30 years, it jumps all the way to 18%. That's a huge increase, and it's why surgery becomes such an important option for so many people. Now, when surgery is the right move, the most common option today is honestly pretty amazing. It's called the J-pouch procedure. The whole goal is to get rid of the diseased colon, but then to restore your body's natural pathway for digestion. The idea is to give you back a life without a permanent external bag. Okay, the fancy medical name for it is ileal pouch anal anastomosis, or IPAA. Yeah, it's a mouthful, I know. But the idea behind it is actually pretty simple. It's a well-established surgery where surgeons create a brand new internal pouch that's designed to work like a rectum. So how does it actually work? Well, it all starts with step 1, removal. This is where the surgeon takes out the entire source of the problem, the diseased colon and rectum. By taking that out, you get rid of the tissue that was causing all that inflammation and all those symptoms. Then comes the really clever part. In step 2, the surgeon takes the very end of your small intestine. That part is called the ileum, and they actually fold it over on itself into the shape of a J. This is what creates that new internal pouch that's going to hold waste. And finally, we have step 3, which is all about reconnection. That brand new J-pouch is carefully attached down to the anus. This completely restores the body's natural pathway, and it means you can go to the bathroom the way you always have. It's about getting back to life. Now, while the J-pouch is definitely the gold standard for most people, it is super important to know that it's not the only option out there. As we all know, medicine is never a one-size-fits-all kind of thing. So, depending on your unique health situation, your surgical team might talk to you about other approaches. For instance, an end ileostomy is another path that results in a permanent external bag, and for some people, that's absolutely the right choice for them. The other options you see here are a bit less common, but they exist for very specific cases. The big takeaway here is that your surgical plan will be 100% tailored to you and your body. Okay, now for our last section. And this is a piece of information that is so important for you to have, whether you're managing with meds or you've had surgery. It's about really understanding what's going on when your symptoms suddenly take a nosedive.
Here it is, the critical point. When you start to feel worse, your first thought is probably, oh no, my UC is flaring up. But that's not always what's happening. Sometimes what feels exactly like a UC flare is actually a totally separate infection that's just decided to move into your already inflamed colon.
And figuring out which one it is, well, it's everything. Why? Just look at the treatments. A flare is caused by your immune system, so you treat it with drugs that suppress your immune system. An infection is caused by a bug, so you treat it with antibiotics that attack the bug. If you take immunosuppressants when you actually have an infection, you can see how that could be really dangerous. You'd just be letting the infection run wild.
So, what kind of infections are we talking about? Well, there are two usual suspects that doctors are always on the lookout for. One is a bacteria called C. diff, and the other is a virus called CMV. And the really tricky part is that an infection from either of these can look and feel almost identical to a UC flare. This is exactly why the experts say that any IBD patient with worsening symptoms has to be checked carefully for an infection. And this is where you can be your own best advocate. If you're feeling worse, it is always worth asking your doctor, hey, could this be an infection? And that really brings us to our final thought for today. Knowledge truly is power. Being an active, informed partner in your own healthcare can literally change your entire experience. So I'll leave you with this to think about. What's the most important question you are going to ask at your next appointment?